Welcome to a new episode of our weekly web series Science in Context. A study collaboration between Imperial College London, Cambridge University and the UKHSA was published in the Lancet today, providing the most detailed insight yet into the severity of Omicron. I'm Sabine and joining me today is Prof Neil Ferguson. Neil, what was the main finding from your study?
So we found that overall, averaging across all cases we saw in the Omicron wave, that Omicron was about 70% less likely to result in death than Delta and about 60% less likely to result in hospital admission. But underneath those headline averages, there was a lot of variation between age groups. So the under 20s, for instance, Omicron and Delta severity was very similar. Biggest reduction was in the 50 to 70-year-old age category. And then in the most elderly, we saw slightly less of a reduction.
What can you say about the effectiveness of vaccines against Omicron?
Omicron is what we call an immune escape variant, so vaccines overall are somewhat less effective. But the good news is, as long as you'd had a booster dose, your risk of hospitalisation was at least 75% lower than somebody who had not been vaccinated.
Your results show a reduced risk of severe disease in older age group. What does it mean for hospitalisations?
That reduced severity is why the Omicron wave, despite having hundreds of thousands of cases a day, we had relatively low numbers of hospitalisations, or at least hospitalisations the NHS could cope with. The challenge going forward is that we have lifted all control measures in the UK. We no longer have case isolations, and that's leading to something of an uptick in cases and hospitalisations. Our modelling suggests that that's not going to be an overwhelming fifth wave of transmission, but it is, of course, of some concern.
Several major surveillance studies will end in the next few weeks. How will this affect our response to the pandemic?
The UK put in place a kind of gold-plated surveillance system against COVID-19 from about June 2020 onwards. And that's given us unrivaled data with which to track the epidemic, but it was very expensive, so it can't be sustained forever. I'm encouraged that we're keeping good hospital surveillance in place, so people admitted to hospital are being tested, the genetic sequence of those viruses still being collected, so we will spot reasonably quickly new variants coming in, but there will be some delays compared with what we had up till now.